You know that moment in medical school when you're staring at a question about protein misfolding and your mind goes completely blank? Today, we're diving deep into amyloidosis, the protein disorder that's been stumping medical students across NEET, PG, FMGE, and NEET exams. By the end of this episode, you'll understand the most frequently tested concepts, common exam traps, and how to tackle those tricky clinical vignettes. And joining us today is our resident pathology expert.
Thanks for having me. You know, amyloidosis is fascinating because it's not just one disease, it's a whole family of disorders where proteins misfold and create these twisted clumps in various organs.
I've noticed it keeps showing up in exams. What makes it such a popular topic for test makers?
Well, according to recent exam patterns, amyloidosis questions have evolved from simple recall to complex clinical scenarios. The 2025 NEET PG particularly focused on systemic manifestations.
Can you break down the main types that students need to know?
Absolutely. The three most commonly tested types are AL amyloidosis affecting plasma cells, AA amyloidosis related to chronic inflammation, and ATTR from transthyretin protein.
And these show up differently in exam questions?
Exactly. For instance, AL amyloidosis questions often focus on cardiac and kidney involvement, while AA amyloidosis questions typically link to chronic inflammatory conditions.
You know what's interesting? I heard there's actually a fascinating history behind how we diagnose amyloidosis.
Oh, yes. The term amyloid was first used by Rudolf Virchow in 1854, thinking these deposits were starch-like. It's a great example of how medical terminology can be misleading.
Wait, so they got the name wrong?
Completely. These deposits aren't starch at all, they're proteins. But the name stuck, and now it's a key term students need to know for exams.
Speaking of diagnosis, what's the deal with Congo red staining? It seems to come up a lot in questions.
That's another fascinating historical connection. Congo red was actually developed as a textile dye in 1883, but it became crucial for amyloid diagnosis because it creates that characteristic apple-green birefringence.
So we're still using a cotton dye from the 1800s as our gold standard? That's kind of amazing.
Exactly. And it's still one of the most frequently tested diagnostic criteria in exams. Students need to know that apple-green birefringence under polarized light is pathognomonic.
Let's talk about exam strategies. What are some common traps students fall into?
Based on recent exam patterns, one major trap is focusing too much on individual symptoms rather than recognizing the systemic nature of the disease.
Can you give an example?
Sure. A question might present a patient with heart failure, but also mention subtle signs like macroglossia or periorbital purpura. Students often miss these systemic clues.
That's really helpful. What about treatment-related questions?
Treatment questions often focus on the specific type of amyloidosis. For AL amyloidosis, chemotherapy comes up frequently. For ATTR, they might ask about organ transplantation.
Are there any particular organ systems that get more attention in exams?
According to recent exam analyses, cardiac and renal manifestations are heavily tested. The 2025 NEET PG had several questions about cardiac amyloidosis specifically.
That makes sense, given how common these presentations are.
And don't forget about the genetic aspects. ATTR amyloidosis questions often include family history as a key diagnostic clue.
How do students keep track of all these different types and manifestations?
I recommend focusing on patterns. AL with plasma cells, AA with inflammation, ATTR with hereditary features. These associations help in quick recall during exams.
What about imaging findings? Those seem to show up a lot too.
Yes, particularly echocardiogram findings in cardiac amyloidosis. The speckled or granular appearance of the myocardium is a high-yield concept.
And lab values. What should students focus on?
Serum and urine protein electrophoresis results are crucial. Also, recent exams have emphasized the role of cardiac biomarkers in diagnosis.
I've noticed questions are getting more integrated across specialties.
That's a key trend. The 2025 exam pattern shows more questions linking amyloidosis to other conditions like multiple myeloma or chronic inflammatory diseases.
How should students approach these integrated questions?
Look for patterns. If you see protein abnormalities plus organ dysfunction, think amyloidosis. The key is recognizing these connections.
Any tips for time management during the exam?
For amyloidosis questions, first identify the type based on clinical presentation, then work through organ involvement. This systematic approach saves time.
What about rare presentations? Should students worry about those?
Focus on common presentations first, but be aware of classic rare findings like shoulder pad sign or raccoon eyes. These make great image-based questions.
Speaking of images, any tips for handling those?
Always look for that characteristic apple-green birefringence in histology images. It's the most commonly tested visual finding.
And what about treatment options? How detailed should students get?
Know the basics for each type. Chemotherapy for AL, treating underlying inflammation for AA, and transplant options for ATTR. That covers most questions.
Are there any new developments students should be aware of?
Recent exams have included questions about newer treatments like targeted therapies, but they're usually not too detailed at this level.
How do you suggest students practice these concepts?
Previous year questions are crucial. The pattern from recent exams shows a focus on clinical application rather than pure recall.
Any final advice for our listeners?
Remember that amyloidosis questions test your ability to connect dots. Look for systemic involvement and think about the underlying protein abnormality.
That's really helpful. Let's summarize the key points for our listeners.
Focus on the three main types, AL, AA, and ATTR. Know their associations, diagnostic features, and basic treatment approaches.
And don't forget about those systemic manifestations.
Exactly. The multi-organ involvement is what makes amyloidosis such a challenging and interesting topic in exams.
What's your number one tip for exam day?
Read the clinical vignettes carefully. The diagnosis is often hidden in subtle clues about multiple organ systems.
And remember the historical perspective we discussed. It really helps understand the terminology.
Yes, knowing why we call it amyloidosis and why we use Congo red staining helps make sense of the whole topic.
This has been incredibly informative. Any last words for our listeners?
Keep practicing with previous year questions and always think systematically. Amyloidosis is complex, but it follows patterns.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, understanding amyloidosis isn't just about memorizing facts. It's about seeing the connections.
And just like those misfolded proteins finding their way to different organs, let these concepts find their way into your exam preparation strategy.
Thanks for joining us today, and good luck with your exam preparation.